I'm Dr. Nerita, a urologist with 12 years of experience. And today we're going to break down exactly what determines ejaculate volume, what you can do to optimize it, and why prostate health is absolutely central to this conversation. Stay with me, because understanding this isn't just about volume, it's about maintaining overall reproductive and urological health as you age. The first myth we need to address is that ejaculate volume is purely a measure of masculinity or sexual prowess. While it can certainly affect confidence, the real story is far more biological. The reality: ejaculate volume is determined by several factors: hydration status, prostate health, seminal vesicle function, frequency of ejaculation, hormonal balance, age-related changes. The practical truth: as men age, it's completely normal for ejaculate volume to decrease. This doesn't mean you're less of a man, it's simply a reflection of natural changes in glandular function and hormonal levels. However, if you've noticed a sudden, dramatic decrease, or if low volume is accompanied by pain, difficulty urinating, or other symptoms, that's a sign you need to see a urologist immediately. It could indicate prostate issues, blockages, or other conditions that need medical attention. Before we dive into solutions, if you're finding this valuable, please hit that like button and subscribe. Drop a comment below. Where are you watching from? I love connecting with men worldwide who are serious about their health. To understand how to increase volume, you first need to understand where ejaculate comes from and what can interfere with production. The key players: seminal vesicles. These glands sit behind the bladder and produce about 60 to 70% of your ejaculate volume. They create the nutrient-rich fluid that nourishes sperm. Prostate gland. This walnut-sized gland sits below the bladder and contributes about 20 to 30% of ejaculate volume. It produces a milky fluid that helps sperm motility. Bulbourethral glands. These small glands produce pre-ejaculatory fluid, the clear fluid that appears during arousal. The critical pathway. All of these fluids travel through ducts that converge in the urethra, the same tube that carries urine. When the prostate becomes enlarged, a condition called benign prostatic hyperplasia, or BPH, it can squeeze the urethra and block or reduce the flow of these fluids. The practical effect: an enlarged prostate doesn't just make urination difficult, it can significantly reduce ejaculate volume because the fluid literally can't get through the narrowed pathway. Let's break down the 4 most common factors that reduce ejaculate volume and what you can do about each one. Factor number 1, dehydration. The biology: your body is about 60% water. Semen is a fluid, and if you're chronically dehydrated, your body simply doesn't have enough raw material to produce adequate volume. The alcohol connection. Alcohol is particularly problematic. When you drink, your body releases antidiuretic hormone ADH, which causes dehydration. Even 2 or 3 drinks can measurably reduce ejaculate volume the next day. The practical fix: drink plenty of water throughout the day, aim for 8 to 10 glasses. If you drink alcohol, match every alcoholic beverage with a glass of water to offset dehydration. Factor number 2, frequency of ejaculation. The biology: your seminal vesicles and prostate need time to refill after ejaculation. If you're ejaculating daily or multiple times per day, your glands simply don't have time to replenish their stores. The practical effect: men who ejaculate less frequently every 2 to 3 days typically report higher volume than those who ejaculate daily. The balance: this doesn't mean you should avoid sexual activity, but understanding the relationship between frequency and volume can help set realistic expectations. Factor number 3, poor prostate health. The biology: as men age, the prostate naturally enlarges. This process, called BPH, is nearly universal in men over 60. An enlarged prostate can physically block the ejaculatory ducts, reduce the prostate's own contribution to ejaculate, compress the seminal vesicles, reducing their output. The emotional impact: men with significant BPH often notice not just reduced volume, but also a weaker stream, dribbling, and less forceful ejaculation. This can feel deeply emasculating. The practical solution: regular prostate health monitoring, medications if needed, and proactive lifestyle changes can slow or even reverse some of this enlargement. Factor number 4, nutritional deficiencies. The biology: your body needs specific nutrients to produce healthy, voluminous ejaculate. Key nutrients include zinc, critical for prostate function; L-arginine supports blood flow; selenium, antioxidant for reproductive health. The research on maca root. One interesting supplement that's gained attention is maca root. A small study followed men aged 22 to 44 who took maca root daily for 4 months. The results showed increased ejaculate volume, improved sperm count, better sperm motility. The important caveat: these benefits took 3 to 4 months of consistent use to appear. This isn't a quick fix, it's a long-term investment. If you're serious about improving ejaculate volume, here's your actionable plan. Step 1. Hydrate consistently. Drink at least 8 glasses of water daily. If you exercise heavily or drink alcohol, increase that amount. Think of hydration as the foundation. Without it, nothing else will work optimally. Step 2. Space out ejaculation. If volume is a concern, try spacing ejaculations to every 2 to 3 days. This gives your glands time to fully replenish. Step 3. Support prostate health. Get regular prostate screenings starting at age 50, earlier if you have risk factors. Consider supplements like saw palmetto or beta-sitosterol, which some studies suggest can support prostate health. Stay physically active. Exercise reduces inflammation and supports healthy prostate function. Step 4. Consider evidence-based supplements. If you're interested in trying maca root or other supplements, commit to at least 90 days of consistent use before evaluating results. Choose high-quality, third-party tested products. Discuss with your doctor, especially if you're on other medications. Critical note on prostate massage. Some research and clinical experience suggests that prostate massage, whether external, perineal, or internal, can help clear blocked ducts, improve circulation to the prostate, reduce inflammation. While this might sound unusual or uncomfortable, vibration therapy for prostate health is actually well documented, particularly in rehabilitation settings. If you're curious about this approach, talk to your urologist about safe, effective options. I want to be very clear about something. Your worth as a man, your sexual adequacy, and your ability to satisfy a partner are not determined by how many milliliters of fluid you produce. Many men carry deep anxiety about this, comparing themselves to unrealistic portrayals in adult media or worrying that their partner is secretly disappointed. In reality, most partners care far more about emotional connection, communication, and mutual pleasure than they do about ejaculate volume. That said, if improving volume is important to you, whether for fertility reasons, personal confidence, or simply curiosity, these strategies are legitimate, science-backed approaches that can help. The key is to approach this with patience. Your body isn't a machine with instant upgrades. Changes take time, consistency, and a holistic approach to health. Gentlemen, optimizing ejaculate volume is really about optimizing overall reproductive and urological health. When you stay hydrated, support your prostate, maintain good nutrition, and manage frequency, you're not just addressing volume, you're investing in long-term sexual function, comfort, and confidence. Your body is capable of incredible resilience and adaptation at any age. Whether you're 50, 60, 70, or beyond, small, consistent changes can yield meaningful improvements in how you feel and function. Don't let embarrassment or shame keep you from having these conversations with your doctor. We're here to help you maintain vitality, dignity, and quality of life, and that absolutely includes your sexual health. If you found this helpful, please share it with someone who might benefit.